thing I got out of that was, meet your wife early, marry her, and just listen to her. Everything she says is right. Just do what she says.
I'm sitting right here.
That would have fast tracked it a little bit quicker.
Let's be sensible now. Yeah. No, that is true. That is true.
Hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. Greetings CPD Junkie podcast fam, I'm your host Lawrence Doan, and today we are joined by Dr. Ronak Patel, aka Ron.
Hey, how you going?
He graduated from London's prestigious Guy's, King's and St Thomas's Dental School in 2003 before working extensively in private dental practices throughout the UK. Drawing on his impressive experiences as a dentist, he decided to establish his own practice with his wife, Priya, who is also a dentist. They then immigrated to Melbourne in 2011, where he joined the East Melbourne Dental Group. He would like to credit all his success to his wife. Dr. Ronak Patel, welcome to the show.
Hey, how you going? You all right?
So, tell us about your CPD or dental journey so far.
It's pretty extensive considering I've been doing it for a while. I suppose it all started luckily in the UK. We have vocational training, so every Friday we get together with a little group that we have, and there's always be some ongoing teaching and getting us used to dental practice. And I think I was lucky at the time that my brother-in-law was a dentist, and we kind of did a couple of courses together. One of the main ones I started off was with the Hornbrook group from America, and that was on occlusion. So that kind of got me going in there really. And then the rest of it slowly just took off just as we went along, bit by bit. And yeah, that's it really.
Right. So you were kind of in your family already had some affiliates with the dental field, and that was kind of what drew your attention to it, or?
No, look, I mean, dentistry was one thing that I just got introduced to. It was just an option to do. It sounded good. I got accepted, and then away I went. Really, that was pretty much it.
Fair enough.
And then just along the way, I've just been lucky to meet some fantastic people in dentistry who've just kind of mentored me along throughout my nearly close to 20 years really, and that's kind of helped shape my path, I suppose, and my philosophies and things. So yeah.
Well then, I mean, when you first graduated, right, you're coming out and you're kind of doing all these courses. Did you dive straight into like endo or cosmetic dentistry earlier on?
I definitely dove straight into endo. That was when my first practice that I worked for after graduating, which was the vocational training practice. My trainer was heavily into root canal treatment at the time, and he'd get me to just root treat anything, just to really get my hands in there and make sure that I had the confidence to do it. It's a shame he never really got me to extract teeth, because the extraction side suffered more so. But yeah, so he pushed me to do a lot of that stuff, and because of the way the NHS was geared, we learned a lot about doing rehabilitation. In that, just purely because there was a limit to how much patients were ever expected to pay, and we were able to then still carry on the rehab treatment. Just the government subsidised it. So we learned a lot of complex restorative work, and also full mouth rehab cases through that NHS and the time there. And having a very good, in my opinion, my trainer is very good. So having a good trainer backing me up and overseeing the work and whatnot really helped me make sure that I realised I was making the correct thought processes and decisions really.
So it was the endodontics mentoring. Then, I mean, you realize that, okay, my oral surgery extractions needs a bit of help. Is that what happened? You kind of dived into that next? Is that what happened?
No. I've never really managed to get out of that side of things. Priya is heavily into taking teeth out. She really enjoys it. So I used to kind of just, funnily enough, I got into a point where I would refer just my extractions to her, or she happened to be on site when I'm taking teeth out, and I'll be, right, here, I've just numbed the patient. Do you want to take it out? So she'd come in the room, quickly take the tooth out and go, right, you finish up. So she'd just walk out and leave me to like stitch and tidy and everything else. So I was like, yeah, I'm happy to do that. That's no problem. And now I'm lucky to be surrounded by a couple of great dentists who do a lot of complex oral surgery, and anything that isn't like grade 2 mobile, off it goes to the associates, and they take care of it for me.
So how did you make your transition from the UK to Melbourne in Australia?
So basically, back in the UK, when I met my wife Priya, we got married, and at the same sort of time, we decided to set up a private practice, and I wasn't enjoying the NHS side of things, so I said, right, I've had enough. My skill set doesn't really gel well with the way the NHS system works, so private will suit me more. And so we set up a private practice. It's just kind of the Indian thing to do, to really have your own business. So we thought I thought I'd give it a go. Priya at the time had a very good position in an NHS practice, and her income was pretty good, so that helped roll the private practice, and we started it from squat. I think we had it for 2 years, didn't we?
Just over 2.
Yeah, just over 2 years, and it was doing well, and it was a success. But both of us were kind of like, look, we're not satisfied with what we're doing. She's seeing 40, 50 patients a day, and the job satisfaction wasn't great. I just didn't enjoy running the practice. I just enjoyed the clinical side of things back then. And one of her friends had organized a trip to Peru on the Inca Trail, and we're sitting on the side of a mountain, and at the same time both of us just said, you know what, I want to change, let's do something different. And so at that point we kind of realized, we want to try leave England and go somewhere else. And we ended up setting, I think it was between Canada or Australia, and it was either a close flight to London and cold weather, or a long flight in warm weather. So or warmish weather, given the fact we're in Melbourne. And then we just thought, let's just give it a go. So we sold up and just moved over and gave it a crack. And to start off with, it wasn't great. Our jobs fell through, and we weren't sure. But just something said to us, it's the right place to be. And we were very lucky with East Melbourne Dental Group that we managed to get a position there, the both of us, within a few months of being in Australia. And that practice it grew. They had about a day and a half for us. And I think Priya and I just settled in 4 days from the outset. And we just grew the list, and the practice just kept growing. And it was a lovely, small, family-run practice right in the heart of the city. And they just let me get on with what I knew I could do. And that allowed me to just get on with the work and improve myself and go from there, really. That was kind of it. And then we realized there was no looking back. And I think one day Graham said to me, right, you've been here about a year or so, Priya's expecting the first baby. So, what's your plans? Do you want to go back? Do you want to stay here? Because, I need to know. And I think at that point, that kind of just gave us the final ultimatum of, you know what, we're going to stay. We like it, and let's just make it happen, really. So, it was the best decision, I think. Really, it was good.
Yeah. Well, I mean, let's all admit it. Secretly, the Australian summer beach weather is a lot better than all the cold weather in the UK, right?
Oh yeah, definitely. I mean, look, I miss the snow. And Christmas is weird just without snow, and, on the beach in my shorts. But I don't think I'll ever get past that. But let's face it, it is so much better here.
So let's dive into it. I mean, because how did your implant journey start?
How did my implant journey start? That started with, how did that start? That started with the birth of my first child, actually. So so as we all know, I don't like taking teeth out. I'm not, I don't like surgery. Not that I don't like it. I've just never been comfortable with it. I can do it. I just don't feel uncomfortable with it. And I think MIS were doing a course in Colombia, And a friend of mine introduced me to the course and said, "Yeah, it's actually something worth doing." And I thought, "Hey, why not?" So I went off and I did the course in Colombia, and this was what, about 10 years ago, something like that, wasn't it, Chris? Yeah, and and it was basically, you just go over, you whack in about 10 implants, do 2 sinus lifts, and hey, off you go, right? And so the surgery part of it was fantastic. It was great. You really get your hands on going, and you feel really quite confident. And then I got back, and actually Priya was expecting, and literally I think I managed to get my first case up and ready and going. Jacob, who was the main guy at MIS, who was on the Columbia course with us, says, "Right, I'm going to come and supervise you and come and watch you while you do it." And so I got my first case ready. Priya gave birth, and while she's in hospital recovering, I nipped down to St. Vincent's to see Harry Schlen to go over the case, and he goes, "Yep, you're ready to go." And so that was it. Really, off I went. But honestly, I was really quite scared to do it. I just didn't feel like I had the theory part behind me really quite well, and the case I'd chosen obviously wasn't fantastic. And so, long story short, it kind of just scared me, and I thought, right, I don't want to do any more. Fast forward to about 3-4 years, and my good mate Kalyan Voroganti, he goes, "Oh, look, you really should get back into it." And he brought me in on a case he was doing to say, "Look, let me show you how I do it." And so we went through it, and I thought, oh, actually, you know what? It's really not that difficult. I've got the skill. I'm already trained. I can do simple cases. And then I went back to I spoke to Kane at MIS, and he basically got me going again. Just said, right, well, let's work with you. Let's get you past this mind block that you have of whatever it is that, for some reason that you seem anxious. And we'll sit down with you. We'll plan the case out completely. We'll double check it. We'll triple check it, and off we go. And fast forward to a couple of years, and here I am, and I'm doing simple cases. So it's great.
Right.
I still hassle my friend Kalyan for every case that I do.
Why not, hey? I mean,
exactly.
I would just want to ask, during that time when you did your first case, and you didn't feel quite comfortable with it, to holding off for about 3-4 years, and then doing your next case. Did you, in that time, go through a process where you're still kind of learning about it, but you might not be implementing, or was it completely at the back of your mind?
No, it's completely at the back of my mind. I was too busy. I was too busy with other things. Like at the same sort of time, I did a bit of Inman aligner work as well, and so I was doing a lot of alignment and wear rehab. So that kind of took over a lot more of my time. East Melbourne was the first practice I've ever used CEREC in. And so I really threw myself into that as well. I really wanted to learn how to improve myself with the CEREC machine and get better results. So I was really just busy with Inman, Invisalign, Ortho, and CEREC to really worry too much about the implant side of things. And I just found that I wasn't really finding cases that needed implants. I didn't have patients who were missing that many teeth, or if they were quite happy with the bridge. But the main thing was that most of my patients were dentate, and they weren't missing teeth. It was mainly just crowding and stuff. So that was that. But when I did get back into it, when I was saying with Kane and MIS the second time around, I joined up with the Straumann course at Melbourne Uni. And so that was great with Stephen Chen and Ivan Darby, and they kind of handheld me through the theory and the placement of implants and things. So that really gave a lot more confidence in that respect.
This is the ITI that you're talking about.
Yeah, that's it.
Yeah,
mine was a smaller course. It was only about 8 modules. It wasn't the full-on 2-year thing.
Well, tell me about, during that time when you were learning about Inman aligners. I mean, were you a top Inman aligner provider and trainer at some point?
I wouldn't say top. That's for sure. Look, the Inman aligner I learned back in the UK, along with Invisalign, And it was just kind of another bow to the quiver, I suppose, is what the saying goes. And over here, yeah, there was one point, I think 1 month, most probably, I kind of hit, the most production of immunoliners for Australia for a little while. I think it all just fell in the same month, so that was pretty much it. And I think how I got involved with Inman over here was I'd only done the basic course back in the UK. I wanted to kind of just cement my knowledge a bit more and do some more advanced stuff. So I decided to try the advanced course and over here in Australia. Robbie Shemi and David O'Malley, they were taking the course here. And it kind of just re-cemented for me my philosophy of aligning and rehabbing of worn teeth. And it just made me realize that, hey, actually, you know what? My thought process regarding occlusion and how I want things with my patients is actually quite solid and sound. It matches David and Robbie's. It matches Tiff Qureshi's, who runs the Inman program. And so, yeah, that was pretty much it. And I think, coincidentally, Robbie asked me to kind of help out a little bit on some of the courses. And at the same time, one of a good friend of mine in the UK, turns out he actually owns 50% of Inman Aligner. And so he got me to help out as well. And just the two kind of merged, and I ended up just helping out in the training sessions, really, with these guys. And then, yeah, that was pretty much it.
So would you say that that's where you learn your orthodontics first?
No, I did back in the UK when I did Invisalign quite early on, and back then it was like a 2-day course. 1 day impressions. First day was impression, second day was clean check, third day, right, off you go, see you later. Yeah. And I was kind of like, this isn't great. And I tried a few cases. I was like, oh, I'm a little bit stuck. It's not working as well as I expected to go. So what's going on? So along with my my VT trainer, I press ganged him. We did a fixed ortho course, a diploma in fixed ortho, basically. And that kind of taught us the mechanics of orthodontics and being able to apply that with Invisalign and clear aligners, because the patients I had, they were more interested in Invisalign than fixed braces. And back then, my in private practice, I didn't really see children. I wasn't a big keen fan of pediatric dentistry, so I avoided seeing children and taking teeth out for a very long time. And so most of my patients were adults, and so, yeah, that kind of helped me understand the mechanics of clear aligners to a certain degree. Fast forward to now, I've been doing some form of orthodontics all the way through, and then fast forward to now, and I'm like I said, I'm surrounded by some very fantastic dentists who. One of which is my business partner, Fadi Goa, and he is a gun with orthodontics and Invisalign. And my other associate, Namu Park, he is fantastic as well. So, any cases where I think, this is quite interesting, I get to sit down with two guys anytime I want and go, right, let's run through this case. Let's make sure my thought process is correct. And it's great. So that kind of really helps me with my ortho side of things, really, and just make sure that we're able to provide like a complete package and just be able to see everything.
Because a lot of graduates come out thinking, like, do I jump into aligners first, like removable orthodontics, or fixed orthodontics first? I mean, do you have an opinion on that?
Yeah. My opinion is communication. Forget all that other crap that you see. And in hindsight, if I could go back, the one thing that I would definitely do more of, and my brother-in-law used to say this to me, but it just used to rile me up the wrong way, so I'd never pay attention to it. And it was communication. He goes, you need to learn to speak to people on their level, and they need to be able to understand what it is you're trying to explain to them. And I was very socially inept previously, and I could not speak to patients. I couldn't communicate with them clearly that on their level of what was required in their mouth, and that what I found was that held me back in terms of experience, because you couldn't get your treatment plan across the line. And I'm talking simple things like, learning to do quadrant multiple crowns, or, like anterior smile makeovers, veneers, that kind of stuff. So yes, it's all well and good coming out and going, right, I want to do implants, smile makeovers, veneers, ortho, whatever. The biggest thing that I took away from my experience is, if I'd learned to communicate better with patients and just get my basic treatment across the line, I would be a lot further ahead than I am now. And that's even without jumping into courses and things. Mind you, having said that, just before obviously this podcast, I was looking back at my CPD list of when I started doing CPD. And to be honest with you, other than the occlusion course I did with my brother-in-law, partly because he paid for it, I didn't really start. I didn't really start any of the major Invisalign and ortho stuff until maybe at least 3-4 years out. So I solidified my general dentistry a lot, and then I went on to the other things. It's the type of dentist I am. I actually don't. Even then, I didn't have the confidence to go, right, I'm just going to jump straight into something brand new and start doing all this stuff. I really just want to make sure that my basics were doing well before I go anywhere else. And then it's just, and what I tell my dentists as well is, in terms of CPD, and when they ask me, oh, should I do this, should I do that? Do everything. Take your time, do everything. From each course, you'll always learn something. Yeah, it doesn't matter how much you take home. Because you're either going to repeat the course at some point, or you're going to do another course on the same topic, which will jog your memory and help you learn something a little bit new that you either didn't pick up at the previous course or whatnot. And so, when they say what's the best course, look, there isn't one best one. Yeah. You either may not gel with the way a certain trainer's teaching you, or their philosophy of it. Even though it makes complete sense, you just might find that you learn better through someone else. So you have to do a course to realize that actually wasn't for me.
Yeah, I relate with your story, because a lot of graduates come asking me, like, they want to learn implants really quickly, or they want to learn ortho really quickly. I got to learn it all at the same time. But to your point, you just got to slow it down. Just get your basics right, get your communication right, and then kind of dive into some of those things.
Exactly, because there's no point in learning all these fancy courses. And I think, because my ortho diploma was about 2 years, and I think the EODO course here and POS course are at least 3 to 4 years. If you can't communicate that and get that treatment plan across the line, there's no point, even having the skill set, because you're just not able to practice it. And I think I had that issue with implants, where I wasn't able to communicate it very well back then. So even though I wanted to try and get some implants across the line, I wasn't really able to. And that's, forgetting the fact that I didn't really understand half of what I was doing at the time as well. So yeah.
Fair enough. So along the way, cosmetic injectables kind of came into the situation.
That came in quite early. I think.
Okay. Yeah.
So again, this all started in the UK. I did a lot of my training in the, my CPD and stuff, and started getting my experience in the UK. What happened? Yes, I remember. One day, Priya just got bored of dentistry when she was at the NHS, and she decided to do, what was it you're doing? Semi-permanent makeup? I think she decided to try semi-permanent makeup, like eyebrow tattooing and a few other odds and sods. And so she thought, I might be able to offer this at the practice as as something different, just to keep her interested. And through that, we were talking. I think what happened, we were talking to one of my patients about it. And it turns out she is a GP with a special interest in injectables. So we thought we'd try and get her in, but it kind of fell flat on its face quite horribly. And through that, we decided, hold on, why don't we try some injectables and see whether or not we can make it work. So there was a doctor by the name of Brian Franks in the UK, lovely guy, and so we managed to get onto a course that he held just specifically for Priya and myself. It was amazing. So we had a whole 2 days, wasn't it? I think with just Brian, Priya, myself, and the models. And they supplied the model, so we were under no pressure to supply. And they just let us go nuts with everything. They were like, yep, you have as much Botox as you want to use. You have as much filler as you want to use. You have like 4 or 5 models between you to do whatever you want. So we got some really good comprehensive training. Whereas these days you can get them, you have to bring your own model, and, you know, depending on how much the model wants you to do to them, because they don't want to look like a freak on the way out. You know, you can only do a little bit here and there. Whereas we would let loose and manage to practice a whole lot of things. And the after support was great. So that helped out quite well. And we managed to choose the first couple of patients really well, who were like, yeah, I'm definitely up for trying something. And so that worked out quite well. And also back in the UK, in cosmetic injectables, was, you know, it's something we were absolutely fine to do. Whereas up until recently, it's been a very grey area in Australia. So when we moved over here, I had to obviously keep my hand in it with just working on the nurses, or you know, just you have to stay within your remit and whatnot. And yeah, that was it. And I managed to keep up my training because originally when I moved over, I thought I'd try the ADFA course. So I did that. I had to do that back then. The only people insuring you were Experian, and they would only insure you if you did the ADFA course. So I tried that course, and you know, it's a good enough course, but something from that course changed my life, which had absolutely nothing to do with injectables, which we'll get back to later. And then very recently, just before Christmas, I think it was, I topped up my training again with the fantastic Julia Diana here in Melbourne, and so that allowed me just to advance my skills a bit more. But it just, you know what, it's just an extra bit of something. And I was lucky enough to learn it a long time ago, that it's not really taken any time off me now. So I just do it for a bit of fun, really, more so than anything else.
Yeah. Do you want to dive into that little experience that you had that would change?
Oh yes, yeah. So basically, I met a dentist by the name of Henry Muller by chance on our ADFA course, and we got talking about CEREC, and I was explaining to him, well, you know, I don't really know much about it, and I'm kind of learning as I go along, and I've had these horrible experiences of my restorations not fitting very well or whatever and whatnot. And he introduced me to DPR and CEREC files on Facebook, which I never knew existed. And I joined at the right time, when you could really learn a lot of things. People were posting a lot of cases. Sahil Sony used to post a lot of cases and his rubber dam things. So I joined at that time when you really got to learn things very well off Facebook, and that changed my life. And especially when you saw people posting, especially on CEREC files and things like that, I realized, okay, so this is the quality of work you need to be producing for CEREC to be working very well for you and whatnot. And yeah, you want to emulate what you see there, and so it pushes you to step up that bit more. And I still maintain, you know, if it wasn't for Henry, I wouldn't have ever found out about CEREC files or DPR, because I just wasn't into Facebook or online at that particular time. And again, it's through all of that I made the connections through other dentists that I know that have helped me along the way.
Right. And is that how your adhesive dentistry journey kind of came into all of it?
No, adhesive dentistry again was something that I just I don't know where it came into. I was thinking about this because you touched on it previously. I was thinking about it as to how I kind of fell into it. And I think it's always just been a philosophy of mine of really just to try and get the job done as minimally as possible. Obviously you want it to look nice and whatnot and last as long as possible, but I want to do it as minimally as possible. Sometimes I push the boundaries and I'm a bit too minimalistic, and you're kind of like, yeah, should have cut the tooth there. But I think I've always been like that, where it's like the patients I've been surrounded by are those that are really just crowded. They've got somewhere, and I can't really justify once I straighten them up or bleach and go, right, just do 10 veneers. because I'm like, you really just don't need it. You can just need a bit of bleaching, and then I can top it up with some composite. And I started realizing, actually, I'm not too bad at building these teeth up with composite. They look quite nice. And we did a lot of Dahl in the UK, and so yeah, I was like, hey, this worked quite well for me. And I think when I met Tiff and the Inman aligner guys, it kind of just re-cemented that, yeah, look, you know what, my thought process is exactly the same as theirs. And if these guys are doing it successfully, then hey, I'm quite happy to be doing this as well. And it's grown from that I look at it going, well, do I really want to do veneers and all that kind of stuff? Hey, yes, I'd love to be able to do work like you see on these guys like Lincoln and Tony and Sahil and all those guys, right? Yeah. And all the greats that you see online. I'm nowhere near their level. I'm not bad, but I look at it and go, right, if I can get away with it simply, then hey, fantastic. That's easier. And I think that's where the adhesive dentistry came in. And I think CEREC has helped that to a certain degree as well, to be minimalistic. I do know that I hassle some of the CEREC guys like Lawrence Lau and whatnot, where I'm like, hey, I want to do this minimalistic. How do I just do like a minimal prep, like CEREC CAD veneer out of milled composite? And he's looking at me going, yeah, you need to cut the tooth. I'm like, you sure? so yeah, you know, and you learn from your mistakes where you're like, yeah, that doesn't look so great. I need to, I do need to cut a bit more back and redo that one and things like that. So yeah, at least when you're minimalistic, you can try it out first and go, yeah, that looks good. Or no, actually, I think I need to, I think I do need to pick up the drill and cut a bit here.
Are you saying you look to Lawrence for some words of wisdom and you're just like, no, I'm going to still go ahead and try it. And then you're like, okay, maybe he was onto something.
Yeah, Lawrence gives me some great advice. He's got a standard line, which is just be a better dentist. And I don't know if he's actually giving me good advice or he's just telling me I'm crap. But, but yeah, it does. It's yeah. You know, there's a lot of guys that I do kind of run my cases through, and it's nice to get the opinions and whatnot. But I think after about 18, 20 odd years in the game now, I kind of realized that my thought process, I've got the confidence in my thought process now and how I do things I'm confident teaching it to my associates and saying, hey, look, this works.
You touched on that really briefly, but you mentioned the Dahl effect. There's a lot of graduates hear about it too, right? And you mentioned that you started learning about that early on. Talk to me about that learning process. Did you learn it back all the way at uni, or did you just start coming out and learning about it because it's in the UK?
We learnt it back in university. Again, back then, I think back then it was like it is here a bit now, unless I'm completely mistaken, which is like, it was concept. It wasn't something that we used to do a lot. And one of the things that intrigued me as an undergraduate that we never really spent time on it was a Lucia jig. And I was always interested in deprogramming and a Lucia jig, a leaf gauge. My interest was just like, why the hell do we have them? How do you use them? What the hell are they for? And I would find constant cases where I was like, it makes sense to deprogram this patient. And the moment someone says deprogram, I'm like, Lucia jig, leaf gauge. I'm like, what's going on here? Right? Why is this constantly coming up? And so, you know, I'd look at the case going, right, you know, we've got these worn down front teeth. We need to open them up. And well, I don't really want to sit here doing all these crowns on the back and cock it up, because once you cut a tooth, we're stuck. So yeah, that's where you know, there was this concept at that point saying, right, if you let the teeth, you know, if you take away the stop, they're going to overerupt. And we were telling patients, is constantly going, yeah, well, if you take out this wisdom tooth and the opposing one doesn't have a stop, the opposing one's going to grow down. Well, that's dull, really, at the end of the day. And then we were also doing cases where you've got people who are worn down. You're like, right, I need to intrude you. How am I going to do that? Well, you know, we'd use some sort of dial appliance where we put a plate in your mouth and you sit on it until everything pushes up and levels off. And And doing all of that kind of stuff just made you realize, well, hold on, it's actually a very simple way of doing this, which is just build up the worn down bits of teeth and then let the rest of the mouth just settle in. And all of a sudden you come full circle and you realize, well, actually that's what they were teaching us back at university concept wise with Dahl. And that's what the Inman guys kind of picked up and went forward with. And Tiff Qureshi was kind of reinforcing that philosophy. And I spoke to Tiff and he goes, yeah, it's completely valid. It works. The research is there. And I started doing that on my cases, and I've been around long enough at the same place, luckily, that you start seeing your mistakes, and you get to learn from them. But two, you start seeing the successes, and that was one of the main successes for me. That I'd see these patients dull and the posterior contact close, and I go, this is working, great, fantastic, and that was it really.
Right. So, a lot of graduates also reach at a point in the 4 or 5 year mark. They start to contemplate practice ownership, being a specialist, or being a super GP. Can you share your thoughts on that?
Yeah, definitely. Hey, we were all undergrads and we're like, I want to be a specialist in this, I want to be a specialist in that. Yeah. And then I came to my senses realizing, well, hold on, you really have to love this one particular aspect of life and want to go back to university for X amount of years to want to do this. And I was like, I kind of just want to be a jack of all trades. I don't really want to just do one thing, because I really wanted to be an endodontist. That's how much I hated taking teeth out. So no, I really like the concept of you're either right or you're wrong in endo, because when you look at the x-ray, it's like, yes, it's there, or no, it's not. Whereas all this arty-farty, just feel the tooth and you'll feel it loosen out. No, I don't understand that. And so I think the practice ownership bit and whatnot, look, it all depends on what people really want at the end of the day. I think one of the main things for me that's got me to where I am, and where I am is I am a general dentist, and I own my own practice, and I have a partnership in 2 others with a wonderful business partner called Fadigawa. But what's got me there is Priya. She is the brains behind everything. She is the reason that I'm, shall we say, successful enough for you to want to talk to me. In that respect, so Priya's a dentist. She kind of didn't really enjoy dentistry. She's great at it, she just doesn't enjoy it. She enjoys business and investing and using her brain in other ways. And so so she got us into the business side of things. And when we moved over here, I was adamant I didn't want to do practice. I was like, nah, I just want to do teeth, and that's pretty much it. I don't want the hassle of it.
Because you'd already tried squatting, right? At that point,
we'd already done the squat, and then when I was at East Melbourne, just an opportunity came up, and unfortunately the practice I didn't get a chance to buy it, and we were kind of like, well, that was the plan, what do we do now? So Priya was working part-time in a practice locally, and she turned around and we said to the guy, well, you're not a dentist, you just inherited it, do you really want it, can you be bothered, we'll take it off your hands. And he was happy to. So Priya took the practice and she ran it as a business. She worked in it a little bit until she fell pregnant with our second child, and she ran the practice with associates after that. Then when she was expecting the third child, it was taking an hour to travel to the city and whatnot and back, and we don't have any family here. All our family's back in the UK, so it wasn't feasible. And I tried looking for a job closer to home, and it just ended up being, right, well, here's a practice for sale, I might as well just buy that instead of having a job. And so we just, no matter how hard I tried, I could not get out of practice ownership. I just ended up with the practice every single time. And so then we kind of realized we actually enjoy this. We're pretty good at practice ownership and running a business and getting it started from wherever it is and growing it. And especially Priya, that's her forte, I enjoy I enjoy the sound of my own voice and teaching teaching my philosophy to the dentists and the therapists, and how I want things. Whereas Priya enjoys the business aspect of things. So it was quite a good matchup really for us to do things together. And so that was a kind of our reasoning to go into business. And then when we, like I said, I'm really fortunate to be surrounded by the dentists that I am surrounded by. And an opportunity came up, and we decided to go into partnership with Fadi and get our next practice and the one after as well. So we just found, along with him, we just enjoy the business side of things a lot more. And both of them, Fadi and Priya, have and Priya more so, because obviously she's been doing this for, we've been married for a very long time. 13 years possibly. But we married a long time. And so Priya's set up my life in such a way that the practice is centered around me. I am a glorified associate. The staff take care of me. And I am lucky to have a great team as well. And so it's great that basically I just sit there, do my work, and the business is run for me. And so that allows me to kind of take on a bit more of a mentor role with some of the younger dentists. And I enjoy that. I definitely enjoy that. Priya, like I said, enjoys the business side of things. And along with Fadi, so Priya and Fadi both, they run all three practices and let me kind of just deal with the dentist side of things. Really. And I found that I enjoy that. And I'm kind of glad that I went that way as opposed to the specialist side of things. But hey, who knows? Yeah, if I'd been a specialist, things might have been different. So, but it's just, I think when people are deciding what they want to do, it always goes back to the first thing: communication. Learn to speak to people. Learn to speak to your patients. That way, you learn how to do your basics in dentistry. Once you can get your basic work across the line, which you are fully competent with when you leave university, you can then start to understand what it is you like and don't like, and then you can kind of narrow down your fields of right, I only kind of want to do this part of dentistry, or I kind of just want to focus on this and this, that, and the other, and that kind of stuff, really.
At some point, we're going to have to introduce Priya to our audience, for the people who are either listening or viewing.
You let me know, and she'll actually kick me into the kitchen to undo the dishwasher, which is all the time you're hearing behind me, right? So you let me know when you want to speak to the real brains of the operation. So, yes, of all those CPDs, did you mention one in particular was a game changer for you? Actually, no. You know what? To be honest with you, I was really... I know you asked me this like ages ago, right? There isn't really one that's been a game changer for me. And I was thinking about this along with a question that came up on one of the forums once of, who's been the most influential for you? And I got to be honest with you. The biggest influence mainstay in my life is Priya, because like I said, not only does she set me up to be able to do what I want to do when I want to be able to do it, but I get to talk to her about all these courses, because you know what it's like when these courses come out and you get this like FOMO. Oh, I want to do this course, but I don't really know why I want to do it. I just want to do it. Yeah, it's like this this one that I've got to sort out. Sorry about that. Basically, it's a course that I'm going on that my friend Cal's got me on. It's for Tony Rotundo in Sydney. And basically,
a soft tissue one?
No, it's I do want to do one of those actually. No, it's restoring all on four. And I was kind of looking at it when we did it. I was like, I've never had an all on four case, and any edentulous patients I've got, no one can really afford to have it done. So, is it really worth me doing it? But then part of me is torn, like, it's Tony Rotundo, man. Like, you can't turn it down. I want to go. And I'm like, should I do it? Should I not? And so, I get to speak to her, and she just puts it in perspective for me and goes, how useful is it going to be for you? Versus how much do you really just want to do it for shits and giggles and just go have a laugh at Cal in Sydney, and things like that, right? So, and I find that's been really influential to help me narrow down my focus, because, sometimes, a lot of the times I'll get courses that come out of left field and she's like, why? Like, it makes no sense. It's not really part of your skill set, and you're going to offer it once every 20 years. What's the point? And it's kind of a good cold bucket of water over your head to make you realize, hey, actually, it's just, it's a waste of time, right? And so that's helped me keep focus and not like dawdle too much and waste my time. But also, like I said, I've just from the beginning, I've been surrounded by just fantastic dentists. I've been lucky, especially when I was young and very naive, that the people that I met really they were the right people. They were nice. They led me the right way. It started with a couple of demonstrators at university, and then my first boss, Amin Gavani, he was my VT trainer. This guy was just brilliant. You know, he was just like, look, at the end of the day, just do good work. Don't worry about anything else. Everything else will follow. And that was a philosophy that I've always tried to stick by. And that's led me really, really well. My brother-in-law's always been useful. He's always stood by me and helped me through thick and thin, so that's always been good. And then Priya would be next on that list because obviously that's when I met her chronologically. There was my first. I call him my boss. He was an associate at the practice. He used to own it before he sold it. And him and the practice manager at this practice in the UK, in my first private practice, they taught me how to move away from NHS and start treating private patients. And a lot of lessons learned there. And again, it was fantastic because he was into taking teeth out and placing implants. I used to do IV sedation. So he'd call me and go, yeah, you sedate the patient and I'll place the implants. And so, you know, that was fantastic. But then when we moved over here, again, we were really lucky. Graham at East Melbourne, he was fantastic. His first line to me was, "Don't copy what I do. Just don't." I was like, all right then, fair enough. But he just left me alone to get on with my work. And if I had questions, I could run and buy him and whatnot. But he was literally like, "Don't annoy the patients. Be sensible," and that was it. And I was there for 6 years, my longest job position, but I managed to grow a lot there because I had the time to do courses. He let me go and do things and whatnot. I learned CEREC there because he had the system and he let me loose on it. But like I said, unlike some bosses who just stifle you and whatnot, he just left me alone and said, just go do what you want. And I wasn't one of these associates that I want a brand of composite and I'm only going to use it once, or I'm not into that kind of stuff. I'm just like, I like simple things. And I was a bit of a diva. I still am. But yeah, I was a bit of a diva and he'd have to pull me into line every now and again. But he just left me alone, which is just fantastic, which is great. And I really loved it there. It was nice. And then since I've had my own practice, I've been lucky to be surrounded by, like I said, Priya, Fadi, Namu. And then there's obviously you all know Kalyan Varaganti, who's a good friend of mine. And I run a lot of pretty much all of my implant stuff through him. And that is great to have him as this will be the only second time that will be heard in public and never again, but as my best friend, because just, you know what, he's such a lovely person, this guy. Nothing's ever too much trouble. And it's nice to have that backup with your cases and things. And you can always run things by him. And again, we have the same philosophy. So, you know, you're not torn by like, am I doing the wrong thing? This guy's thinking completely different to me. And so that's always nice. And again, luckily, I work near a guy called Andrew Chow. And he, again, as everyone knows, this guy is just so lovely. And again, nothing's too much trouble for him. And you know, and from other people such as like Lawrence, Steve Tiang, Howard Yin, and James Yap in Singapore and whatnot. These guys, I've just been so lucky to be surrounded by these guys and talk to them that I learn something every time. And I feel that that's the most important CPD that I get, non-scientific, which is basically just you have a chit chat, you have a laugh, you run something through these guys. And you're like, wow, you know, and Andrew Thorpe as well. Like, there's so many guys that out there that I talk to, and you learn so much from these guys. And so yeah, and they're all genuinely lovely people. They all want you to do well, which is a big change from where I came from. And yeah, and it's thanks to all of these people. I feel that that is where I've learned all of my things. You know, even Tiff Qureshi in the UK. I chat to him every now and again, and you pick up these little hints and tips, and it just solidifies that, right, what I've learned over these years is correct, and I'm going the right way. Mind you, also tell you that you're doing it completely wrong. Stop.
I will say one thing good about a podcast is that it's recorded for eternity. So, once it's out there, they can always refer back to it.
We can edit that bit. I might have, it's a bit late for me. I'm a bit delirious. Past my bedtime.
If he watches the video, he might think you're tearing up whilst you were saying it too.
Oh, hold on. This isn't. I thought it was just a podcast, man. This is how backwards I am. Yeah. No. It's a bit like, I'm definitely not tearing up, man. I hate the guy.
So, one thing a lot of graduates want is mentoring, and you kind of alluded to it. People interpret that differently. Some people want to be held by the hand, want to be checked in once in a while, and some people want to be on the wall. You've mentioned yourself, you like the fact that, you'll be checked in once in a while. So, what are your thoughts to recent graduates or associates who are looking for mentoring?
Look, I think, something I've talked about previously is I really envy the vocational training scheme in the UK, because you're pretty much handheld. You have a mentor there who will handhold you through your day. I remember asking stupid questions like, I can't get this matrix band on. Like, what am I doing wrong? Or like, hey, look, I'm really struggling trying to prep this part of the tooth. What kind of angle am I needing to do? I used to ask dumb questions like that. But it was great to not be judged. I'm sure Amin would go back to her and go, man, what did I hire? It was great. It was great to be able to have that, right? And now I really wasn't the most confident person out of the box, because obviously I wanted all of that. And I'm sure there are different dentists out there who are just gung-ho going, yeah, man, I know everything. I'm off and I'm great and off I go. And kudos to them, right? At the end of the day, I wish I had that back then. I'd be a lot further along than I am now. But look, in terms of mentoring, I do. The problem is making sure you get the right mentor, one who understands what is required of a mentor for the student that they have. Yeah, because again, not everyone matches everyone at the end of the day, and it's all well. You kind of have to be careful about. So how I've been talking about this is my philosophy and whatnot. It's all well and good having this philosophy. I can't shove it down my dentist's throat. It may not be theirs. It may not be for them, right? And I remember having dentists who are like, no, I just want to do 10 veneers. That's all I want to do. And I'm like, that's kind of my thing. And I'm like, you're like 2 years out. It's really not your thing. You haven't got the experience. But look, if that's really what you want to do, I can't help you. I can teach you some of the stuff, but it's not something I can do. And you have to learn to understand that at that point, right? Okay, it's not right for them, for that person to learn from you, because it's not how they want to learn. But I think I think definitely we do miss that over here. When I look at the new grads, that they're not confident in certain things, in certain basic aspects of dentistry, and you're kind of like, wow, what was I like that back then? Mind you, obviously I'm like 18, 20 years in, so I forget. The memory forgets all the bad stuff. Like, yeah, that was great when it came out. But I think definitely, it's always nice for new grads to have mentors, to have people look over your work, your notes, every little thing. Because at the end of the day, I know I made a few clangers, and I was like, right, well, how do I get out of this? How do I explain this to the patient? And it's nice having a supportive boss to come in and go, right, let me take over a little bit here, because you kind of need some help here, or other times, you look over some work and you can kind of see that they're stepping themselves into trouble. They just haven't realized, and they're not too far in. It's great. It's recoverable. Just give them the hint and they'll see it for themselves. So yeah, I definitely think mentorship is great. It's just means different things to different people at the end of the day. Yeah. But you've got to have time to do it. Like, one of my younger dentists sent me a case last night, and she's like, yeah, can I have it planned for Friday morning, please? I got to see the patient. I'm like, and thanks, how am I going to do this? But luckily we all got it done. Quick phone call in the car this morning, and yeah, we sorted it out.
Oh, that's great. So, have there been any struggles that you haven't mentioned already in your journey that some of our viewers might not have known about?
I'm sure there have been struggles. I just like in what kind of way, I suppose. What do you reckon?
I mean, it could go anyway. I guess you could. I mean, I think you've mentioned some of the clinical aspects. You've mentioned some of the transitions coming here. How about the fact that juggling being a super dentist slash owner slash husband slash father to three kids all at the same time?
Honestly, this is the bit where you really want to meet my wife. Yeah, like I am literally all of that can be summed up in one word, right? Like as or two words, glorified associate. That is me. Priya does all of that. Like she runs the businesses, runs the house, looks after the children's schooling, the whole lot. Makes my lunch. I get my lunch made every day. It's fantastic. Bam.
You're living the life.
Oh man, back before I used to get dinner and breakfast, but yeah, no, it doesn't happen.
I take what you can have, right?
Say again.
Take what you can get.
Exactly. Look, it's a lot of juggle, but both Priya and I are kind of we're active. We like to get things done. We're always busy, and we're surrounded by people who are similar as well, of that mentality that we're just always busy. We don't just sit down and go, right, I'm going to do jack shit now. I'm done. There's always, even if we try that, we've tried that, and 2 days later we're like getting antsy, going, no, we need to do something. And so yeah, that's kind of us really. So I think that's kind of how we manage things. We just get your head down and plow through. But I suppose that was the mentality our parents kind of instilled in us, and that's kind of how we were trained on the NHS as well. That just you got 40 patients to see in a day. There ain't no complaining. Just get on with it, get it done, and that was pretty much it, really. So I think having had that time where the time that we came from 20 odd years ago, that was just what life was, and that was what was expected of you, basically. And I think that's kind of just built us into who we were. Who we are.
Yeah. Can you share what you hope your ideal clinical day or non-clinical day might look like in 5 years' time, and how you want to do to get there?
I really want to say retirement.
Sorry, retirement.
I said I really want to say retirement. That's my constant thing every morning. I want to retire. No. Look, my ideal day. Actually, you know what? I'm not far from my ideal day, to be honest with you. Like I said, everyone's managed to set me up to pretty close to where I want. At the moment, it's a couple of CERECs a day, along with, say, maybe thrown in between, doing a diagnostic wax up or sort of planning for implant work, and then in between all of that, just whatever's left over, fillings or bit of Botox or fillers or stuff like that, going into my hygiene room, and having my wonderful therapists Tara and Victoria, just they've prepped the patients, they've done everything, they've pretty much done the checkups. I just go in and just chit chat with the patient, really. Other days it'd be nice to do an implant and whatnot, and implant or two, or a bit of a rehab case, things like that. I generally tend to do longer appointments, so I'll find like a nice day is just one patient in the morning, one patient in the afternoon, and not like for 20 minutes, like the whole morning, or the whole afternoon. And I like those because you're just getting on with one thing, you're concentrating on one thing, you pretty much shut the door, you tell staff not to disturb you, and just that's pretty much it, really. And off you go, and that's it. But I like chopping and changing. I'm always whinging about things, but I like chopping and changing. I don't mind whatever comes, as long as it's not wisdom teeth extractions. I'm not doing that stuff.
No, that's fair enough. I mean, on the point of wisdom, could you share some of your words of wisdom to if you could share words of wisdom to your younger self, what would it be?
What would it be? Oh wow. Okay. What words of wisdom will we share, Priya, to our younger selves? Definitely go and do a communication course. I can't hammer that home enough. Yeah.
Yeah.
So much so that I try and do one every couple of years. Actually, it's nice to be motivated to have that. keep learning. Yeah, keep learning, but keep learning different things. Don't be afraid to try things. Really, try new things. Uh, Obviously, be sensible about things, and try and surround yourself by people who will grow you. Really, at the end of the day, I suppose those are my words of wisdom. If you put me on the spot. All right. So one thing that really gave me a kick up the backside was back in the UK. We had to market and do the website for our squat practice. And you got these private dentistry awards, and there was a practice who, when I worked for my brother-in-law, they wiped the floor with us with all these awards. Now, these awards, I don't know, I won't go into them too much, but the following month, the private dentistry magazine did an article on this particular dentist's brother, who he's a doctor. He graduated but didn't want to do medicine. Like Priya, was into business and whatnot, and he went into website designs for dentists and whatnot and marketing. And we met him, and this guy, he decided to work with us, and he just gave me a real good kick up the arse about communicating and talking to people and getting my plans across the line and things like that. And the biggest thing I used to find was every couple of months he'd call me to catch up and go, right, how's your numbers tracking, number of new patients, all that kind of stuff. But we'd sit and chat for about 10 minutes, and he'd give me so much motivation. And it was literally like just going a communication course. I was just motivated after talking to this guy. He's just Mr. Positive. And I got to admit, that was a turning point, at which point I was like, right, I've really got to improve how I come across and whatnot. And that helped me improve as well. So, I think that was a good turning point for me, really. If I'd known that earlier, I'd be a bit further ahead than where I am. But to be honest with you, I do talk to Priya about where we are. It's hard not to think, could I have done better, or where are we at? How are we going? Have we done well and whatnot from where we came from? And to be honest with you, I think look, we've done quite well. I've learned a lot from the people that I'm surrounded by. And I'm surrounded by, and the gift that I've got is that I'm surrounded by lovely people, and who look after me and they teach me. Yeah. And so, I think if I could have had that earlier, I'd be a bit further along the line. Mm-hmm. But hey, I'm still relatively young in dentistry terms. So.
One thing I got out of that was, meet your wife early, marry her, and just listen to her. Everything she says is right. Just do what she says.
I'm sitting right here.
That would have fast tracked it a little bit quicker.
Let's be sensible now. That is true. That is true. Well, actually, I am pretty lucky. We did meet pretty early, and we did get on with things pretty early, didn't we? One of the things, we took risks. We took our risks early on, but one of the things we got to do a lot, and I suppose this is the advantage of coming from the world's greatest city, London, is the fact that being in London and Europe and whatnot, we did a lot of traveling very early on. My dad took me traveling when I was very young, and so I've always wanted to travel. And Priya and I just did a lot of traveling when we were younger, before moving over, and I got that done
thank
before.
God for that.
I really thank God for that. Actually, got that done before we got serious with like the businesses, children, and all that kind of stuff. Careers, that was it. So that's another pro tip. Do all your traveling early, get it done.
You got to introduce her now.
I'm going to introduce her now. All right, I'm going to hand it over to her for a moment. You can chat to her, and I'll be back in a bit. So this is Priya. So Lawrence,
Hi, Lawrence. How are you?
Good, thank you. Hi, Priya. It's lovely. Nice to meet you.
Nice to meet you too.
Look, hey, I guess we're kind of wrapping up with most of the things, but I was going to say, I was asking the community for questions, and the common question I got asked was to ask about was the 3-ply, 4-ply tissues. I can't explain that. Could Ronak explain that?
3, 5, 4. Yeah, I'll get Ron to explain that one. I'll bring him back. Hey, Ron, here. This one's for you.
What's it?
The 3-ply, 4-ply tissue thing.
Oh, 3-ply, 4-ply tissue. Oh, yeah. It's just a running joke. I think we were looking for associates during the time when Howard Dean was making a joke about being charged for charging his mobile phone. And so at the time we were like, what do we have that's different in a comical value? And so I'm pretty partial to luxury toilet tissue.
4-ply all the way, hey?
That's it.
I'll be sure to bring that. For any future associates, be sure to bring a 6-pack of that, right?
Actually, no. For any future associates, I've got to admit, only one associate out of all the associates I have met, and all the potential dentists I have met, there's only one that came in and won me over within 30 seconds. And that was Namu. He walked in with a box of donuts, and no one has ever repeated this fact. I don't understand why, yeah? And I'm like, all right, you're hired. And that was it.
Do you have a favorite preferred donut?
I like Krispy Kreme standard glaze, actually. That's the nicest one.
There we go. For anyone that's coming to observe at your practice, make sure you bring a box of Krispy Kreme standard glaze.
That's exactly it. Yeah, that's it. But the problem is the staff get to them before I do, so they devour the damn thing beforehand.
So make sure you bring 2 trays.
No, my staff are animals, man. They'll eat them all. It's like a free-for-all. Like, it's announced all over. It's announced over the system. There's donuts, and literally everyone steps out the room. It's like, excuse me, I just need to just step out for a moment, and everyone runs for it.
No, that's fair enough. Well, for Dr. Ron, thank you for coming on the show today. I'm sure we'll definitely get Priya on a future episode. And then if you could let the people know how they could find you or what's kind of going on in your life.
Yeah, definitely. I suppose to find me, obviously, just I'm on Facebook. Is the easiest thing. I'm learning Instagram at the moment. It's kind of a very painful journey. Faddy's banging his head against a brick wall trying to teach me.
Then there's TikTok.
Yeah. Let's not get started on that. I can't deal with that. Priya tried to do a TikTok during COVID, and that led to divorce nearly. Yeah.
We won't share that.
Yeah, we definitely won't be going into that. Otherwise, that's pretty much it, really. Otherwise, what else is going on at the moment? Nothing much else. We're just kind of solidifying the practices, making sure that everyone's happy, that it's all working well, and that they're growing, which they seem to be. The dentists all seem to be enjoying themselves so far. I haven't, made anyone cry yet. That's all good. Look, the thing for us is, so long as everyone's enjoying themselves and they feel like they're getting value from us, that's all we want, really. At the end of the day, we just want everyone to be happy that they're with us and that they feel like we're doing the right thing.
So for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you in the next episode of CPD Junkie podcast. Thank you.
Thanks very much.